After a year of record-breaking dengue infections, Thailand is bracing for worse in 2016. This year, experts say that the number of infections may be on par with the last big outbreak in 1987, when there were 170,000 cases. With the first dengue vaccine already approved in Mexico, the Philippines, and Brazil, Thailand is now under pressure to green-light this long-term strategy to fight the potentially lethal disease. Our correspondent Dusita Saukau reports.
This is the first line of defense against an epidemic that has swept through Southeast Asia. Teams of local officials armed with mosquito killer spraying machines fan out daily around Bangkok in an attempt to eliminate mosquito breeding sites. Last year, Thailand saw 140,000 infection cases, the highest since a mega outbreak of 170,000 in 1987. Officials recorded 126 deaths. The most notable was TV actor Trisadi Sahatwong, who died after developing a series of complications from the virus. His death made the public realize that dengue does not only affect those living in remote areas.
More people are moving to the capital. That's why it's worse than the provinces or small towns. It's spreading because of urbanization and lack of mosquito control.
Thailand's Public Health Ministry is expecting dengue cases to rise by over 16% this year. The reason for the swell is simple. Mosquitoes have more places to breed now that chemical spraying is less effective, and population clusters give the disease areas to propagate. For many years in Thailand, dengue fever was considered a disease that only affected children. But now, most of the new cases reported are young adults. Ratsaat Ying is one of those cases.
While I had a dengue fever, it also affected my liver. Since the dengue virus can cause a liver damage, my stomach became so enlarged, I couldn't eat anything.
The virus starts with aching joints, raging fever and a rash, but if untreated, it could lead to organ failure and worse. For decades, Thailand has been at the forefront of the fight against the dengue virus. Finding a vaccine has proven difficult, in part because of the complex nature of this virus. But with the number of cases expected to rise again this year, the need for a vaccine is becoming increasingly urgent.
This vaccine is developed for about 10 years. The vaccine is not 100% protection. Okay, we know that. But it is some tools that are helpful. Okay. In Thailand, I think they plan to license this vaccine very soon. Okay. And once we got the vaccine, so I think it can reduce some, the problems of the dengue.
For now, Thailand's strategy is to eliminate breeding opportunities for the mosquitoes. But contributing to the seriousness of the dengue challenge, there are growing fears that the virus could be mutating as a result of immunity that has built up in the region. And without a preventative vaccine or cure, millions more will continue to suffer at the hands of a virtually invisible predator waiting to strike. Dusita Saukau, CCTV, Bangkok.